ما هي الطقوس القهرية وكيف تساهم في استمرار المشكلة؟ الأعراض الشائعة التي قد تعطل الحياة اليومية وتستهلك الساعات. نشوف الفيديو.
Although obsessive compulsive includes both obsessions and compulsions, one doesn't need both obsessions and compulsions for a diagnosis. Some individuals might have just obsessions or just compulsions, but the majority of patients have both, often where the compulsion is performed to alleviate an obsession. A very common compulsion is cleaning, which often stems from an obsession with germs or contamination. Another common compulsion is checking, usually because they have obsessions that something's unsafe. So they'll check to make sure that something's definitely safe by unlocking and relocking it, sometimes several times. More generally though, repeating is a compulsion on its own, where an action or phrase is repeated several times. And usually this is done because if it's not, they think something bad will happen. Sometimes patients might feel compelled to order or arrange things, because when they're out of order, it causes anxiety and discomfort. Finally, mental rituals are also obsessions. These are often done to try to neutralize intrusive or what they think are bad thoughts. So they might try and call up specific words or phrases they think are good thoughts to try and replace the bad thoughts. Now, the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, or the DSM-5, gives specific diagnostic criteria to meet for a diagnosis of OCD. First and foremost, they need to have the presence of obsessions, compulsions, or both. Makes sense. The obsessions and/or compulsions need to also be time-consuming, often such that it produces distress with their social life and their work. For example, taking 2 hours every day folding and unfolding clothes and then being late for work. It's also important that the obsessions and compulsions are not due to the physiological effects of a substance or other medical condition. Finally, the apparent anxiety isn't better explained by another mental disorder, like for example, an obsession with personal appearance, like a dysmorphic disorder.